They're so cute when they're sedated. Every kitten should be sedated. He's a good boy.
Little does he know.
Little does he know. Now let's see how we go. He's quite a big cat, so we'll see what happens as we encourage him to snooze. There's a good boy. There's a good boy, I know. What a good man. I know, Daddy. There's a good boy. There's a good boy. Okay, so I've pre-sedated young Felix here, and I've used a product, an injection that actually has some pain relief involved with it as well. And I'm going to take a urine sample just for interest. The owner has agreed to urine sampling. So this is, again, very easy when they're asleep. And that looks well concentrated, so I don't think there's going to be any problems with this cat, with infections and so forth. But I have found in the past that even young cats can have urinary tract infections, presumably coming from the umbilicus. When that gets chewed off by the mother, the bladder actually has an external contact at that point, and it can track up. So there's his urine, looking pretty good, looking pretty strong. Now, castrating a cat is not really a big deal. It's mainly, it is done in various ways with in various countries and depending on the equipment. The absolutely minimum that's been done over the years is to put a cat in a gumboot, head in first. I don't know whether the smell in the gumboot is what anaesthetizes them, and then these little bits get cut off. But we're today at least offering pain relief, and it's just slicing down through the scrotum to the testicle, trying to retain the tunic. This is the actual lining to the abdominal wall. So I prefer to keep that intact if I can. Just do a knot, clip it off, remove the offending item. I do at the end of surgery count the number of testicles I've removed just to make sure, and then we ping it back in. It's quite important that it is returned safely to its pocket here, because otherwise some cats do lick hard enough to turn the scrotum inside out and make it bleed again. So then here we go with the other one. It's a matter of doing a knot back again on itself, slicing the testicle away, tying over itself. There's probably some sophisticated name for this knot. And then there we go. So there are the testicles gone back inside, and then we just hold the cuts closed so that they heal together like that, and the cat's less likely to lick it and open it up again. And that's it. Now I'm giving him a reversing agent, and he's been on a high dose of anaesthetic at this stage. The boys do seem to need a lot more anaesthetic to remove their testicles than the girls seem to need to remove their ovaries, but that's a boy thing, surely. And there we go. If he was an older cat, I'd be very meticulous about emptying his bladder. I'm going to empty it anyway now, but because you don't want the smell of strong cat wee in the surgery if you can help it. So now we turn him off and we're going to put him back with his sister. And how cute is the cat? Actually, I'll just give him his penicillin as well. This is the penicillin injection to prevent that clostridial overgrowth problem that they may or may not have. And also, it is just that extra thing after surgery.